Okay, right now we're going to go through Medicare Part D, the prescription drug program under Medicare. Part D coverage is only available from private companies who are contracted by the federal government, and they are required by law to offer the basic benefits offered by Medicare. Each Part D plan has its own formulary or drug list, so when you are deciding on which Part D plan to select or to enroll into, you always want to make sure that all your prescriptions are covered at the least cost possible.
You can choose to purchase a Part D plan either by purchasing a standalone plan that goes with traditional Medicare and or a supplement or Medigap policy, or you can purchase one as part of a Medicare Advantage Part C plan. You cannot purchase both at the same time. Each plan product may have an additional premium to pay and can differ in the types of drugs covered too. Just like Part B, you may incur a late enrollment penalty for Part D if you decide to delay enrollment when first eligible for Medicare and either did not have some other form of credible drug coverage or do not have extra help to pay for your prescription drugs. I'll cover extra help in a later slide. Unlike many health insurance plans, Part D has coverage stages that determine what you pay in each stage for the calendar year. Dollar limits in each stage can change every year. For this purpose, we are using 2023 amounts. We'll start from the left and move to the right. The first stage is the annual deductible stage. A Part D plan may design its benefits to have varying deductibles based on drug tiers or may not have a deductible at all. Once you meet the plan's deductible, or if none applies, then you move to the next stage, initial coverage stage, also called the copay stage. Here you will pay a copay until your total cost for the calendar year reaches $4,660. Total cost is defined as what you pay plus what the Part D plan pays in total. Not many people reach this limit, but if you do, then you will exit the initial coverage stage and move to the coverage gap stage, also known as the donut hole. While in this stage, you will pay a higher percentage for some of your drugs, depending on how the plan has it structured. Once your personal out-of-pocket cost in the calendar year reaches $7,400, then you will exit this stage and enter the catastrophic stage, where you will begin to pay a much reduced copay or coinsurance for your prescriptions until the end of the year. Then the cycle repeats itself on January 1st of the following year. The Part D plan will tell you exactly where you are with respect to these stages in their explanation of benefit statements that you can pull down online or have them mailed to you. A good rule of thumb is to try to stay in the deductible and initial coverage stages if you can. This will depend mostly on the number of drugs you take and or whether you take brand name or specialty drugs. If you find yourself in the coverage gap or beyond, then you may want to have a conversation with your doctor about alternative prescriptions, providing samples, or seeking to qualify for patient assistance programs or other discounts. The Extra Help or Low Income Subsidy Program is available for those who have limited income and assets and helps by limiting your out-of-pocket costs, reducing Part D plan premiums, and offering you a special enrollment period to change Part D plans more frequently during the calendar year. For some, an annual recertification is required to be completed. I'll leave a link about the Extra Help program in the description box below. If you need an agent to assist you in finding a Part D plan and you live in the states of Texas, Illinois, or Florida, give me a call, send me an email, or book an appointment with me on my website, and I'll be happy to do that for you.
Well, that about wraps it up for today's video. I'd like to thank you all for joining and watching. I will add some links in the description box below related to some of the topics that I discussed. If you would do me a favor and click the like button and subscribe, and feel free to leave any questions or comments at your leisure. To your health.